Assalamu alaikum dear candidates. I am Dr. Nadia Kanval, online teaching mentor. Today we will discuss about the pathophysiology lecture, that is neoplasia. So in this term, neo means new and plasia means there is growth. So actually this is a new growth. So as in the previous lecture we have studied that because of sustained cell injury, because of sustained stimulus, there is metaplasia, that is transformation of one epithelium to another epithelium. If that is persistent, this undergoes dysplasia, that is the cell structure is going to be changed. And if this stimulus is persistent, this in turn leads to formation of a neoplasm. Now this neoplasm is basically a new growth, and this new growth can either be benign or it can be malignant depending upon the features. Now talking about the gross features of the benign and malignant lesions. The benign lesions are usually well circumscribed, they are well encapsulated, their membrane is intact, and the cell morphology and microscopy resembles to the normal, and also they do not have the capacity or ability to metastasize. What is metastasis? Metastasis is actually invasion of the tumor cells from the tumor to some other structures, that can either be by the lymphatics or by blood supply or by the local spread. So the benign tumors are deprived of all these features. They are well circumscribed, well encapsulated, closely resembling to the normal structure, and they are localized. Most commonly they are mobile, freely movable, and not adhering to the underlying structures, and their size mostly remains same over time. However, what happens? The main property of the malignant lesion is invasion or metastasis, that is ability to invade the surrounding structures and to spread to the distant structures either by means of lymphatics or by vascular spread or by the local spread, depending upon the location of the tumor. Now it will not be well circumscribed. This malignant tumor actually shows the property of pleomorphism. What is pleomorphism? That is variation from the normal size and structure. And also it is not well capsulated. It is basically depending upon the we usually describe the grade of lesion, that it is if it resembles resembles good to the normal structure, then it is well differentiated, and if it's not resembling the normal structure, then it is poorly differentiated. And coming towards the microscopic features, in case of the benign lesion, the structure will be same as that of the normal structure, and there will be no increased mitotic figures, there will be no nuclear cytoplasmic atypia, and the membrane will be, there will be no breach in the membrane, and there will be no increased vascularity in case of a benign lesion. However, in case of a malignant lesion, this will show increased mitotic figures. Similarly, the nuclear cytoplasmic ratio is increased in case of malignant lesions, and also the membrane breach will be there. Increased vascularity of the structure will be there, and also, as I have talked before, that pleomorphism, that is, it will vary from the normal size and structure. Now coming towards the examples, usually the benign lesions, they end with the suffix oma. For example, if we talk about the fibrous tissue, it is fibroma. If we talk about the fibroid in the uterus, that is will be termed as leiomyoma. If it is cartilage, it is chondroma. If it is any epithelial growth protruding, it can be papilloma. So depending upon the site from where the benign lesion has arisen, so the name oma, by the suffix oma we usually describe them. Now regarding the malignant tumors, if they are arising from the epithelial origin, then they are usually termed as carcinoma. For example, uterine neoplasm is known as endometrial carcinoma. Similarly, if it is arising from the cervix epithelium, it's squamous cell carcinoma. If it's arising from the ovarian epithelium, it's called as ovarian carcinoma. And if it's arising from the muscle or connective tissue, then we use the term sarcoma. For example, if from the uterus, then it will be rhabdomyosarcoma and also oleomyosarcoma. And if it's arising from the bone, it will be osteosarcoma. If it's arising from the cartilage, it will be chondrosarcoma. Now usually these were the gross and microscopic features along with the examples of benign and malignant lesions. And how does the patient of a neoplasia present to you in case of benign or malignant lesion? Now a patient with a benign lesion is usually not having any features of cachexia. What is cancer cachexia? This is weakness, malnutrition, and generalized body weakness because of aggressive malignant growth. But in case of benign growth, these features are absent. However, these features are present in case of a malignant lesion. And if benign lesion once removed usually does not show recurrence. However, if the malignant lesion is removed and some of the tumor has been remained there, it has not been removed completely or excised not excised completely, then it will show the property of recurrence. So kindly acknowledge the definition of neoplasia, the gross features and the microscopic features and the examples. So these are all this was all the description of the neoplasia. Thank you.